Hello, everyone, and welcome to another episode of The New Norm with Selena Hill. I'm your host, Selena Hill, and today I have the privilege to speak with two fierce activists in the Black queer community. We have Emil Wilbekin, who is the founder of Native Son, a platform created to inspire and empower Black gay men. He is also the founder of World of Wilbekin, which is a multimedia content brand that works with media companies to help tell their stories in areas of diversity, multiculturalism, inclusion, and millennials. Prior to that, he served as the founding editor of Vibe magazine and the editor-at-large at Essence. We also have with us Alphonso David, who is an accomplished and nationally recognized LGBTQ civil rights lawyer and advocate who currently serves as the president of the Human Rights Campaign. He is also the first civil rights lawyer, the first Black man, and the first person of color to serve as president of the Human Rights Campaign in the organization's 40-year history. Thank you so much, gentlemen, for being here with us today.
Thank you for having us.
Thank you for having us.
So let's just jump right into this conversation. Native Son and the Human Rights Campaign partnered with Color of Change to launch #WeDemand, which is a campaign calling for the federal government to release demographic data on the impact of COVID-19 on marginalized communities. Emil, why did you launch this campaign and why is it so important?
Well, the campaign was really launched by all three organizations, and the idea was actually born out of the partnership with the Human Rights Campaign. So the Human Rights Campaign asked Native Son to join forces along with the Body.com to have conversations around the country around Black gay men and HIV and AIDS. Black gay men have the highest rates of HIV and AIDS in the United States. And so we initially did a conversation in February in DC at the HRC headquarters. And then we're gonna do a national tour. Obviously with COVID-19, that shifted everything. And so we then joined forces and thought, after our panel, like what more could we do? And so Alphonso agreed of the importance, and then we also brought in Color of Change to make the reach broader. And so you have three Black gay men leading this charge to get racialized data and equity testing.
Alphonso, let's talk about why this campaign is so important, especially for the Human Rights Campaign. I mean, this organization that you are leading, it has its hands in everything when it comes to equality. Why this campaign in particular?
Well, Emil said it so well. I'm running the largest LGBTQ civil rights organization in the world. And with that comes a responsibility to make sure that we're representing all of us. Now, we did this campaign in part because we cannot ignore the fact that marginalized communities, and specifically Black and brown people, are being disproportionately impacted by this virus. That is a point that we want to drive home to every single person in this country. That if you're Black and if you're brown, that means that you are disproportionately impacted by this virus. And there are a number of reasons why that is. But we need to recognize that, public policymakers need to recognize that and address the systemic problems that lead to that conclusion. So that's one of the reasons why we want the data, because we think that data will actually inform people and it will inform public policy.
Absolutely. So let's actually talk about the racial discrepancies that have led to the alarming rates at Black and brown people being infected and dying. What are some of these underlying issues that's causing this?
Well, some of the issues that are at hand are, lack of health care, living in households where there are, a lot of people living together, which, is very common with Black families and Black communities with blended families. And then a lot of Black and brown and queer people are also essential workers. so they're more prone to be exposed to the virus. And then there's issues that they've found around air quality in Black and brown communities. So this is, this is affecting Black people, this is Latinos, and it's also Native Americans. So it's very interesting that it almost seems targeted at us.
Alphonso, I mean, a number of organizations have been calling for this racialized data. Why is there such a resistance? Why aren't states being more transparent? And why won't the federal government mandate states to release this data?
Demographic data will highlight the truth. That's why. The reason why people don't want to release the data is because it will reflect the truth. People of color are disproportionately impacted by this virus, and it illuminates a legacy of bias in our healthcare system. So people of color have been at greater risk for years, from being used as testing experiments in Tuskegee to developing asthma, as we just referenced, to living in certain zip codes and receiving substandard service. So the data is incredibly important to highlight the legacy of racism and implicit bias that's in our healthcare system and help us create strategic solutions to addressing them. Without the data, we're talking about things in platitudes. Without the data, we're sort of pontificating about how things may or may not be impacting us. But with the data is very clear. And some of the data that's been released is not comprehensive, but the Centers for Disease Control released some preliminary data. It was April this year. And it revealed that 30% of COVID-19 patients are Black, even though that Black people make up 13% of the US population. So that just gives you some insight. And this data, again, is not complete, is missing crucial information on 75% of patients. So, but this data does give us insight into what the problems are, and that's why we wanted to create meaningful solutions moving forward.
Now, Alphonso, the Human Rights Campaign actually released data showing that the LGBTQ community is also particularly at risk to suffer disproportionately in the face of this pandemic. Why is that?
Well, the LGBTQ community is more vulnerable to contracting the virus for both economic and health reasons. I'll give you a few examples. 17% of the LGBTQ people lack healthcare. 1 in 5 LGBTQ people have not seen a doctor when they needed to because they couldn't afford it. 1 out of 5 LGBTQ people live in poverty, which when people hear that statistic, it surprises them, but it's true. 1 out of 5 LGBTQ people live in poverty. And our research study reflects all of these reasons why LGBTQ people are more susceptible to the virus, economic reasons as well as health reasons. And we released that report once again to educate the public and also inform policymakers. You see the stimulus packages that are being issued in Congress. That's great in some instances. But what no one is talking about is that these stimulus packages are being released to local elected officials. They're responsible for implementing the package in some cases through the federal government, in other cases through state agencies. And in those states, 29 states in this country, LGBTQ people are not protected from discrimination. So you can be thrown out of your apartment or denied a job in 29 states in this country because there are no state law protections. And the Trump administration is arguing that we're not protected under federal law. So this research data is incredibly important. It highlights the problem, it elevates these issues, informs the public, and again, importantly, make sure that public policymakers understand when they create solutions, how to implement those solutions to make sure we reach the most marginalized people.
Yeah, that research report is alarming in itself. Emil, what happens when someone is Black and LGBTQ?
Well, they're more vulnerable, right? We already have, as I stated before, like the HIV and AIDS numbers are super high for the Black gay community. You already have a lot of people who are marginalized with underlying health conditions, so hypertension, diabetes, obesity, there's all these other things at play as well. And then with all the numbers that Alphonso just referenced, you put all that together and we are super vulnerable. That's not even including the homeless issue with our youth, that people have been kicked out of their homes. And so there's this problem that we are not being taken care of by the government because we don't have access to healthcare and we don't have the same means to protect ourselves and take care of ourselves. So that's the big issue.
So with the campaign that you launched, what is it that you want people to sign on to? Is it just a call to action to alert the federal government to let them know that we're demanding this, or is there something more?
Alphonso, do you want to?
Sure. There is something more. So we want people to sign up. There's a petition that's been released. We want people to sign up for that petition so we can make sure we communicate to the Trump administration that this data is incredibly important. And we also want people to vote. At its core, what this comes down to is the Trump administration refusing to really treat people of color as people. From year after year after year, they have issued policies that completely attack marginalized communities, including the LGBTQ community. So yes, we want this data. It's going to be difficult getting this data given the Trump administration's history thus far. So we want people to also understand the importance of making sure that voices are heard. We have an opportunity in 6 months to change the trajectory of our country. And if we register to vote and we vote, we can actually have a pro-equality president and other pro-equality candidates in office who will be able to potentially change the trajectory of this country. So once we get the data, we will inform public policymakers, but even if they refuse to give us the data, we're going to keep on pushing, and we will keep on pushing all the way to the ballot box, because we need to make sure they're out of office, and we really need to think about how we can have an infrastructure and institutions that protect marginalized communities.
Alphonso, you recently endorsed Joe Biden in the 2020 election. What makes you confident that he in particular will push for the policies that we need to protect the Black community and actually push for healthcare reform?
So Joe Biden is on record as supporting marginalized communities. He's also on record as being incredibly supportive of the LGBTQ community. So I'll answer that question in 2 ways. One, you compare Donald Trump to Joe Biden because it's a binary choice for us at this point. There is no choice from my perspective. Joe Biden is the progressive candidate. He is the one who is going to actually respect people and provide them with the dignity that they're entitled to. But separate and distinct from that, you look at the substance, and he supports the Affordable Care Act. Trump actually wants to take away protections that currently exist. He's looking to expand protections, non-discrimination protections. Trump is actually looking to take away non-discrimination protections. He's looking to make sure that we have the ability to adopt and foster children. Trump is actually looking to remove those protections that currently exist. So on substance, Joe Biden is the person who's actually going to protect marginalized communities. And when you compare him to Donald Trump, there is no comparison. So for those reasons, we have endorsed him for president because we really need to make sure that we have a president who is going to be protecting marginalized communities, not completely taking us backwards.
Emil, I would love to hear your thoughts as well on the 2020 election. I mean, in particular, there's been a lot of buzz around some people saying Black people in particular do not need to continue to vote for the Democratic Party by default, and now's the time to hold our vote hostage. How do you feel about that?
Well, I asked the question that many people ask is we're holding the vote hostage from whom and for what other option? So, Alphonso said it so eloquently. I think Biden is the only choice. And I think right now it's about how do we support Biden? How do we get out there and how are we active? And then back to the petition, how are we using our own power to actively engage? I mean, part of the petition is to the Health and Human Services Secretary to get this data and to the CDC, but it's also about racialized and equity testing. And so that's the other thing. We want to make sure that we have rights. So for Biden, Biden is a people's politician. He believes in people, and I think that that's what we need. The fact that our country is in chaos right now is a very clear indicator that we don't have the proper leadership in the White House.
In addition to the lack of the racial data, We also don't have, enough PPE, testing in general, but
Mhm.
yet and still, a number of states are reopening for business. What should our community do to protect ourselves? I mean, we're going to sign the petition, we're going to, make our voices heard, but when we have to leave the house, what should we be doing? Or what can we do?
Well, I would say a few things. One, don't trust the Trump administration. Reject everything that they're saying because it is not based on science and it's not based on facts. Two, I would say continue to protect yourselves and your families. Continue to wash your hands. It is critically important. Continue to wash your hands. Use masks when you leave your home, even though it may be not as protective as some suggest. It will make it so that you don't touch your face because you have a mask over your face. So please use a mask. Third, to the extent you can, get tested. I know in some instances it's very difficult to get testing, but get tested if you can, if it's accessible where you live. And fourth, I would say people should continue engaging in social distancing. There's a lot that we don't know, but what we do know is that this virus is extremely contagious. So for minority communities that are more prone and more susceptible to getting this virus for a variety of reasons, I would say please take those steps to make sure you protect yourself and your families.
Emil, this campaign that you guys have launched is so important. But what happens post this pandemic? What needs to be done to build more equitable and resilient, a more equitable and resilient healthcare system in general?
Well, I think, again, it goes back to the voting issues, right? Like we have to be active participants in making sure that we have leadership that can make the proper changes and that can make change that is based on science, change that is based on data, change that is equitable for everyone. I think what's so interesting is that before the COVID-19 pandemic, Black gay men are infected with HIV and AIDS at much higher levels than any other group. And in fact, the CDC had predicted that by this year, 1 in 2 would be living with HIV. Black gay men would be living with HIV. So when you hear numbers like that, but nothing has really been done, it gives us great pause to think, well, what's going to happen with the COVID-19 pandemic when communities in the South are being wiped out and there's no help in sight and budgets are being moved away from the pandemic to open cities? It's like, well, what about all these Black people and brown people and Native Americans who are dying and or diagnosed and have no health care? So we need to continue to push. But again, I think it's participating in the census and voting. I think those are very key things that we need to do as a community.
Emil, you brought up a really important point about HIV, especially how it has hit the Black queer community.
Mhm.
Dr. Fauci continues to compare COVID-19 to the HIV outbreak back in the 80s. Do
Right.
you see any comparisons there?
Oh, I mean, there's so many comparisons. I came of age when the AIDS pandemic had kind of wiped out a whole community of gay men, not just Black gay men, of gay people, but particularly men. And so a lot of Black gay men who are of a certain age, who are in their 50s and 60s and 70s, are very triggered by COVID-19 because there's a lot of, people dying. You can't say goodbye to them. We don't know what the real reasons are. There's a lot of shame around if you're positive or if you've been sick. So there's a lot of similarities and a lot of triggering that is happening. And particularly for the Native Son community of Black gay men who are positive, they are very fearful because many of them live alone. They're positive. What happens if they get sick? If they don't have insurance, then they're afraid to go to the hospital and get help because they can't afford to get the help. So I think these are some of the things that are very triggering to people. But, if you think about the vaccine for HIV has not been made yet. So that's the other piece. The medicines that have been created are to sustain people and to preserve them, but there's no vaccine for HIV or AIDS. So that's the other issue. We're going to go through the same kind of things around COVID-19 where there will be medication and vaccines, but there will not be a cure for this. This is going to be something that we're all going to have to live with.
Yeah, and I would be remiss if I didn't ask you too about the murder of Ahmaud Arbery. Just to switch gears for a little bit, another Black man, 25 years old, running, gunned down in Georgia. Both of you have spoke publicly or posted publicly about this murder, so I want to get your thoughts about this too. And I think, especially like Alphonso, a lot of people are saying, we're in a pandemic. We're supposed to be unified. Racism just won't even let us get a day.
Not a day, unfortunately. Look, I spoke out publicly and I will continue to speak out publicly on this and many other issues of racial justice, because we need to confront the systemic racism and bias in our country. It is here. We have to look at it in the face and we have to confront it. We have to force people to confront the lack of humanity that they have when it comes to certain people of color. And we have to make sure, what Emil said before, we have to make sure that people use their voices for change, because we cannot continue to live in the way that we have. Baldwin talked about, how long do I have to wait for your progress? My mother had to wait. My father had to wait. My uncle had to wait. My aunt had to wait. My nephews have to wait. How long do I have to wait for your progress? We need to use our voices to make sure that people treat us with the dignity and respect that we deserve, and that the laws exist to protect us from people who engage in discriminatory and brutal, heinous actions. And that's what we have to do. That's why I'm speaking out about it, because it keeps on happening. And there's a reason it keeps on happening, because it's deeply entrenched in our nation's culture, and we have to uproot it. And we have to get allies to help us uproot it so that we can move forward, because there is hope. But we won't really get to that place if we don't look at ourselves in the mirror and recognize that we have a problem and we have to address it.
Emil, how disheartening is it that we have to protest for this man's life as we are dealing with this pandemic?
It's extremely difficult to deal with, because we're going through a pandemic where we don't know what's happening, right? We're in isolation. And then to watch this video and see this man like literally hunted down like an animal, it's hard to process. And I think, we are also dealing with, which we don't talk about, mental health issues within our community, especially in the LGBTQ plus community. And when you see these types of violent acts that are done to us, is very, very triggering. So I think it's important that we speak out. I have to say, it made me happy to see how many people posted and how many people made this go viral. And then the two men were arrested. And I think that shows, when we use our collective power, how we can make change. And so, I'm asking the same for the petition, that people really rally around and sign that petition. We have to be really grassroots and community focused right now, because if we're siloed, we're not going to make a difference. If we work together, we can create real change.
Alphonso, as we bring this conversation to a close, we talked about a lot, mental health, HIV. It feels like we lived this playbook before. It just has a different name. We know pandemics always hit the Black community hardest. When America has a cold, we have the flu. So, with those lessons that we've learned, what would you say needs to be done moving forward so that our community can continue to remain resilient?
Well, first, I would say we have to take additional steps to be safe. When they are recommending certain steps for us to take, those steps are mandatory for those who are in higher risk populations. So I would say we have to continue taking precautions and being safe, because people are dying. And unfortunately, many of those people happen to be Black and brown. So continue to be safe. Second, I have to continue to go back to voting. We have to make sure we use our voices at the ballot box. Volunteer to participate in the electoral process. Work with the Human Rights Campaign, work with other organizations, work with Native Son, work with Color of Change, work with any organization that you want, but work with someone to make sure that we can try to change the landscape and vote. We have to believe in the process of voting, because that's our voice. And if we use our voices to have people actually adequately represent us, then hopefully there's room for change. So that's why I'm 6 months from now, I'm hoping we will be having a different conversation on what do we need to do moving forward, as opposed to how can we live under this for another 4 years.
Emil, I want to get your final thoughts as well on what actionable steps our community should be taking now to make sure we remain protected, and also how they can sign the petition and really advocate for this campaign.
So well, I'll start with the petition because that's the easier part. Is the petition can be found on Color of Change's website, and it is also listed in the Native Son Now IG profile. And also, if you're on mailing list for HRC, if you've signed up for that, it's accessible there as well. In terms of what we can do, I think we have to be vigilant right now. We have to really take care of ourselves. And so if social distancing and quarantine is the best route, I know it's uncomfortable, I know it's hard, but us being out in the streets and bars, I saw videos when Atlanta opened, there were parties and houses and people weren't wearing masks and they were drinking and hugging. And I'm like, that is not common sense. So I think we already know that we live in a country where white supremacy and systemic racism exist. And so we have to be vigilant and protect ourselves and our families to make sure that we are safe and we are sound. And we have to just make sure that while we're in the house, that we fill out the census report, that we are signing these petitions, I can't say it enough, and that we are using our voice and our power, that we can go in November and vote.
Yeah, and I just want to thank you two so much for using your voice and literally dedicating your lives for change that we all benefit for. Like, I always commend activists and the work that you do. So thank you so much.